school safety plan with the full support of Ontario's Chief Medical Officer of Health. As a result, students returned to safer schools with significant ventilation improvements in place, along with over 70,000 HEPA units in classrooms across Ontario. We've enhanced the school cleaning and screening, and we've required indoor masking, and we've doubled public health nurses to support safer schools. We also launched a take-home PCR test pilot program and made rapid antigen screening available to all public health units in this province for use wherever they are required to protect students and to protect our staff. Ontario's plan follows the best medical advice. Through our collective work and our cautious plan here in Ontario, we have one of the lowest case rates for youth under 20 in Canada and one of the highest vaccine rates for young people in the country. In fact, 9 in 10 elementary schools and 7 in 8 high schools have no active COVID cases as we speak. The positivity rate for youth age 0 to 19 is now lower than all ages 20 and over. As the Children's Health Coalition and the Ontario Science Table head has said recently, our plan and the strong protocols are keeping schools safe. And today we are taking further action with the support of the Hospital for Sick Children, the Chief Medical Officer of Health, and many other hospitals and public health leaders by dramatically expanding testing options. While our cautious plan is demonstrably keeping schools safe, minimizing disruption, and maximizing safe in-person learning, we are taking nothing for granted. So to ensure we continue to keep schools safe, to make life easier for working parents, and to ensure your child can remain in school, today we're announcing that we're providing take-home PCR tests to all schools for all grades for both symptomatic students and close contact asymptomatic cases for students and staff. We are also launching a test-to-stay program using rapid antigen tests to prevent classrooms or entire school dismissals altogether. And finally, we're mandating a stronger testing requirement on unvaccinated staff who will now be required to present 3 negative tests per week. We strongly encourage those staff members to get vaccinated, but in the meantime, we are elevating our vigilance and our expectations on them. This is especially important for the approximately 1.1 million students in schools who are not yet eligible for a vaccine, which is why testing for the COVID-19 virus remains a key element to help us reduce disruption to our families, to keep kids learning in our schools, and to protect our progress as a province. Les tests PCR à faire à la maison offerts dans toutes les écoles et la stratégie de dépistage pour rester à l'école permettront de garder les écoles sécuritaires. Our new initiative, extended to all public, independent, and First Nation schools, builds on successful models that already exist in Toronto and in Ottawa that are run and supported by local hospitals, including the Children's Hospital of Eastern Ontario in Chio, SickKids, Michael Guerin, as well as the Women's College Hospital here in Toronto. This collaboration and successful program will continue, and we're going to build on that progress and the great work that they are doing right across Toronto and Ottawa. In this expanded program, students will be able to pick up a PCR self-collection kit at school. They can complete it at home and provide the sample at convenient locations within their community. And by enabling students to pick up a PCR self-collection kit at school, the program will help address barriers for students who have challenges with quickly obtaining a test at a testing center when they're symptomatic or have been identified as a close contact of a confirmed COVID-19 case. The take-home approach will also provide convenience for parents and for families and help to potentially identify more cases to keep these schools open and safe. In addition, we're working with local public health units to use rapid antigen screening in targeted schools in specific circumstances to prevent whole school dismissals. Because the goal of this new test-to-stay screening and the PCR take-home test is to keep kids safely in class learning, to reduce absenteeism, to prevent cases from entering our school in the first place. And this voluntary program will enable and support the safety of our kids and keeping our schools open that otherwise would probably close. The introduction of the PCR self-collection program, the targeted test-to-stay screening, and the increased testing requirements on staff will ensure that schools remain safe as we look forward to 2022. This year especially, I want to express a great deal of gratitude for the can-do spirit that has motivated schools and families, hospitals and governments to work together to do whatever it takes to keep schools open and safe. I now would like to introduce the President and CEO of the Hospital for Sick Children, a leader in pediatric health, Dr. Ronald Cohn. Thank you.
Good afternoon, everyone, and thank you, Minister Lecce, for the opportunity to join you today. And really thank you to the entire team at the Ministry of Education for moving forward with this provincial access to take-home PCR testing kits. Over the last 19 months, the physical, mental, and developmental health of children have been significantly impacted by the pandemic restrictions, and it is therefore imperative that we do everything possible to keep our schools open during the current school year and ensure that we create an environment that is safe for students, teachers, and all school staff. And creating this safe environment requires a bundled and layered approach of infection prevention and control measures, which include permanent measures such as adequate ventilation and vaccinations, as well as temporary measures such as masking and physical distancing. In addition to these measures, we are very excited to see the provincial rollout of the take-home PCR testing kits to all students, teachers, and school staff. And I can tell you at SickKids we have administered over 80,000 of these test kits to more than 640 schools across the GTA since the return to school. And from our own experience, we have seen how accessible, low-barrier testing is crucial to keeping students in school while keeping SARS-CoV-2 infections out of school. I would like to thank our colleagues at Women's College Hospital, Michael Guerin, CHIO, Toronto and Ottawa Public Health, and really all of our school communities for working together and successfully implementing the take-home testing strategy over the last few months. I firmly believe that provincial access to take-home PCR testing, together with a test-to-stay strategy utilizing rapid antigen testing, will provide a critical and important step towards ensuring that our schools remain safe and be able to operate with minimal disruptions. Thank you, and Minister Lecce.
With regards to the third test for unvaccinated staff.
Yes.
It's a lot of work for boards to monitor this, and then also the cost of the province. Would it not be easier just to mandate vaccines for education workers?
Well, we have obviously required a higher standard according to the best advice of the Ontario testing strategy of 2 to 3 tests per week. We've adopted that with an air of caution, elevating it from 2 tests per week to 3. We've seen an increase of vaccination. A few weeks ago we were at roughly 17%. Today we're closer to 15%. We are making progress. We're moving in the right direction, but we are taking nothing for granted, which is why we have elevated the requirement on those unvaccinated staff or those staff who have yet to attest that in order to enter our schools, they must complete 3 rapid tests that are negative in order to enter our schools. It is being done in accordance and supported by the Chief Medical Officer of Health. We have great success as in this province with high rates of immunization, one of the highest in the country for the general population as well as for our young people. And we're proud of that. We want to see our increase rate of vaccination amongst our educators. And in the meantime, we're going to increase the requirements, the accountability, and the safety of our schools by mandating a higher threshold of testing on those individuals.
Okay, and with the Test to Stay program, are you looking at other jurisdictions and looking at their experiences? Have there been any concerns as to whether it's safer than quarantining, if there are any issues that have arisen?
The Chief Medical Officer of Health has provided full support for this program, really predicated on a belief that if we can help prevent the dismissal of a class, a cohort, or a school by having access to rapid antigen testing, for a critical mass of students and staff, that could actually not only prevent cases entering the school, but it could allow these kids to stay in school, which is important for the mental health of a child. So we believe this program can be highly effective. It aligns with some of the best advice provided to us from a variety of centers, including the Office of the Chief Medical Officer of Health, who has been clear to us, at the Children's Health Coalition has. We have to do everything possible to prevent a child from going to school. We want to reduce the absenteeism of a child, given the disruptions, the learning disruptions, and the challenges of the last 2 years. So this program is designed to prevent that closure by having a high standard of testing available to a majority of students on a voluntary basis. Public health units in a local community will decide if it is best to use this approach or to perhaps still close the school. Ultimately, we're now making available an option to them that didn't exist before, with the policy aim of preventing closures, keeping kids safe, but keeping these schools open. The regime will be roughly, the kits come with 5 tests. They'll be conducted every other day till the completion of those 5 tests for the PCR, for the rapid antigen test to stay program. And again, it has a thoroughness to the program, to the regime, and we think it will work. And the Chief Medical Officer of Health will be out a bit later today, where he can speak about some of the jurisdictional comparators and where we have seen success with the program within the country.
You mentioned earlier that that First Nation schools are going to be getting these as well. Do you have a plan in place for how you're going to distribute them to remote communities?
So all publicly funded schools will have access to the take-home PCR test. We think that's really important. We're also extending access to independent and First Nation schools. Should they want this program, we will make it available to them, fully funded by the province, and we will get it to them. We have great capacity, logistical ability to get testing to all regions of Ontario, including some of the most remote in the province in the north as well. And in addition, the Test to Stay program being provided for our school system will help reduce risk. So together, when we look at this announcement, it's building upon the success we have of keeping schools safe and open, but we want to support all schools, including those that are not publicly funded, which is why the government is providing that capacity and committing ourselves to get it to them should they want it.
So it's being completely funded by the province. I find it interesting that we are giving testing kits to First Nation schools, but not menstrual products. Can you please explain what your conception of when First Nation schools are your responsibility and when they're Ottawa's?
Well, look, we want to keep all students safe in a public health crisis that is COVID-19. It's why we've expanded asymptomatic testing to a variety of settings, both public and independent. And in the principle, that principle applies today when it comes to extending the take-home PCR test. We want to keep these settings safe from potential transmission, and that's why we've expanded it. We've extended it to them with the aim of ensuring those settings are safe as well.
Okay, we can go to the phone lines for questions here. Just a reminder, it's one question and one follow-up.
Your first question comes from Caroline Alfonso with the Globe and Mail. Please go ahead.
Hi, Minister. Thanks for taking my question. We're now 2 months into the school year, and I'm wondering why you waited so long to roll out PCR tests to all publicly funded schools, and when will we see this rollout be finalized? It's starting in mid-November, so when will all schools be receiving that? When's the timeline for it?
Well, first off, we extended PCR take-home tests to over 160 schools, part of a phased-in pilot on the advice of the Chief Medical Officer of Health to understand the effectiveness of this model and to follow advice from our pediatric and other hospitals that have been providing this type of benefit, the take-home test benefit, to hundreds of schools, 300 in Ottawa and over 600 in the GTHA. What we've heard from them and what we've seen from the result of our first phase is that there's a great benefit for families to reduce disruption, to reduce wait times to get the result, and it's much more convenient for working parents. And so on that basis, especially as we look to the winter, the Chief Medical Officer of Health has approved the expansion of the take-home PCR tests. They will start to be shipped. I mean, keeping in mind they're already in the largest 2 communities and school boards in the province, in Toronto and Ottawa, and now increasingly into other communities in the periphery of Toronto and Ottawa. But the aim is to get these starting to ship by mid-November. We are working in lockstep with the Minister of Government Consumer Services and others in health to get those tests to all schools directly so they can deploy them where they need it, be it for a symptomatic student or an asymptomatic close contact student or staff member. They'll all be available to them. We hope to get it there by mid-November.
Follow-up?
My second question is regarding rapid testing of unvaccinated staff who now have access to this 3 times a week. And I'm just wondering why it's not accessible to the asymptomatic test is not accessible to unvaccinated children. It doesn't make sense to me why it is good for one and not good for the other.
I'm not sure I follow the question. Let's just repeat it.
Why don't public schools have access to regular asymptomatic testing of unvaccinated children?
Well, the take-home PCR test is designed for high asymptomatic close contact students in both elementary and in high school, and symptomatic students full stop. A child on their way out of the school can take one of these tests. They're not invasive. They can be done at home. They have clear instructions, and they're returned to a local community location that is near their home to really increase the convenience and the access to the testing model. We're following the approval and the approach of the Chief Medical Officer of Health. The Ontario Science Table has not recommended mass asymptomatic testing in communities with low risk and low rates of transmission. Thankfully, that continues to be the case in the overwhelming majority of communities in this province because of our good work of the people of Ontario getting vaccinated, following the rules, wearing masks indoors, etc. And so we're going to continue to follow that guidance. We'll build upon, scale up or down the program based on the emerging science. The aim for the government is to keep schools open, keep them safe, create greater access to parents, and reduce the time a child is outside of the classroom.
Next question.
Your next question comes from Chris Herholt with CP24. Please go ahead.
Hi there. Good afternoon. My first question is for Dr. Cohn. Can you speak to the increase in time it takes for full turnaround of a specimen to a result with this new model? Because the Central Toronto hospitals had gotten turnaround down to about 16 hours from specimen collection to the lab to the parent and child knowing the result. And it appears to me that this take-home kit process adds at least another 24 hours to the total completion time. And that's with hospitals taking care of the distribution to and from schools. Are we not making it easier for parents in one way, but making it a harder and longer process for contact tracers and everyone else in the process at the same time?
Thank you for your question. I don't think that's necessarily the case. Of course, parents have the opportunity to go to an assessment center, but I can tell you from a very personal experience as a father in a recent school event that a testing kit was sent home to one of the friends of my children, was delivered, and within 18 hours we had a test result. So I'm not quite sure that that we will delay the process at all. In general, we quote 24 to 48 hours in case there is an unprecedented increase in testing coming to the laboratory, but most of the time it's 24 hours or less.
Follow-up?
My second question is for Minister Lecce. Minister, did you at any time between April 2021 and the start of this school year ever contemplate implementing a widespread rapid antigen surveillance program in public schools like you allowed for private schools in September? And if not, why not?
The government has followed the advice of the Chief Medical Officer of Health. We have followed their guidance with respect to asymptomatic testing. They have not recommended widespread asymptomatic testing within our schools, which was confirmed in the Ontario Science Table report published midsummer. And so in the Ministry of Education, we are responsible and regulate provincially funded schools. The guidance we provided does not request that because of that perspective and advice based on the science presented by the Ontario Science Table and the Chief Medical Officer of Health. And so we're going to continue to follow that guidance with the aim of keeping schools safe as we have done. We are very proud of the fact that 2 million children today are learning in a safe school setting with enhanced ventilation and, of course, with a expanded low barrier testing models, which could include take-home tests, like we've announced today, province-wide for all children in Ontario, and likewise the program we've launched, a test to stay, designed to reduce closures of classes or schools into the future, because we know how important it is for parents and likewise for educators for these kids to stay within the classroom. And so we followed that advice. We are scaling it up today based on the emerging evidence that it is an effective intervention. And because of that adherence to the best medical advice, we have one of the lowest case rates for kids under 20 in the nation, and we have one of the highest vaccine rates. It's not a coincidence. It's because we're doing something right by following that science, following that expertise, and more importantly, because we have high rates of immunization, both for our young people and in the general population, which is helping us to limit the spread of COVID-19 in Ontario.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Minister. I wanted to ask what you envision for schools in the spring. We've seen Ontario's Reopening Act contemplating lifting all public health measures, including mask mandates, at the end of March. I'm just wondering if you envision that happening in schools in lockstep with the public settings in the Act.
You know, obviously our intention for this September was to create a more normal but still cautious reopening program that allowed for extracurriculars and sports, but still required some cohorting, of course, distancing, improved ventilation, the hand hygiene elements, and indoor masking, which have been effective, overwhelmingly effective interventions to keep schools safe. Our trajectory as a province, given the high rates of vaccines, is promising, but we are not letting our guard up. We are being very cautious on any reopening. We are in discussions with the Chief Medical Officer of Health of what Term 2 can look like as we seek to continue to achieve the dual imperatives of safe schools and a more normal school experience. And we'll continue to work with him to finalize that advice and communicate to families in Ontario. But I think our hope and our intent is to create a more normal experience as we go into 2022 with those cautious approaches and steps we have taken that has helped us so far keep schools safe and open in this province.
Okay, so you may be contemplating lifting some of those measures in this same school year, but I don't know, would they necessarily happen at the same time as what's happening in the Reopening Act?
Our school reopening plan has always been outside of the broader reopening framework, as you know, right from the beginning of the pandemic. But with that said, my commitment to parents in the province is to follow the best medical advice to achieve the objectives of keeping the schools as safe as possible, as we have done successfully as a province, in addition to creating a more normal learning experience, even incrementally. And that's our commitment. So we're going to work with the Chief Medical Officer of Health, who we have been working with Dr. Moore for several months now, looking to January, February, and beyond, to plan for that scenario. As soon as that advice is finalized, we'll be communicating it to provide clarity, certainty to families, and give hope to students that by continuing to get immunized, by continuing to follow the rules, we can put the worst of this pandemic behind us.
We can take another question or two from the floor as well if you have any follow-ups, and if not, we can wrap.
Can I ask about extracurriculars?
Sure.
Some boards have them, some schools have them, some don't. Some parents are quite upset about it. You know, they look at neighboring schools or neighboring boards, and their kids don't have football, cross country. What do you make of what's going on, given that you did give the go-ahead for extracurriculars? Yeah,
the Chief Medical Officer of Health did approve extracurriculars in sports for children in Ontario, with some guidance put in place to mitigate, any challenges and to keep it safe. Obviously, local medical officers of health always retained the right and responsibility, should they see fit based on local indicators, to elevate their protocol. Look, in the abstract, without knowing the specific public health unit, I want kids to play sports. I want them to enjoy extracurriculars in a safe manner. I think it's very foundational, as noted by Dr. Cohn, in the context of the development, the social development of a child, that they have those experiences, that social stimulation that they didn't get a lot of in the last few years. So I think we owe it to them to do everything we can to facilitate safe sports and extracurriculars, but we will always defer to the expertise of local medical officers of health to make decisions based on their own locality and with the intent of making sure that they're temporary to the extent possible, so these kids could get back to the most normal learning experience and safe experience that I know they want. Okay.
All right.
Thank
Thanks
you
so
all.
much, everyone.
Appreciate it. Thank you.